Diabetic retinopathy is a condition that affects the blood vessels in the retina, the part of your eye that turns light into images. The blood vessels can swell, leak fluid, or bleed, which can cause changes in your vision and even lead to blindness. It usually affects both eyes and is the most common cause of vision loss for people with diabetes. In fact, it's the leading cause of blindness for all adults in the US. If left untreated, it can scar and damage your retina, so it's important to seek treatment if you have diabetes. Diabetic retinopathy may not show any signs until it becomes serious. When symptoms do appear, you may experience loss of central vision used for reading or driving, inability to see colors, blurry vision, holes or black spots in your vision, floaters caused by bleeding in the eyes. When your blood sugar levels are consistently high, it can lead to diabetic retinopathy. This happens when the small blood vessels in your retina become blocked, causing your eye to grow new but weak blood vessels. These weak vessels can leak blood and fluid into your retina, leading to a condition called macular edema, which can cause blurry vision. As the condition progresses, more blood vessels become blocked, leading to the buildup of scar tissue. This can increase pressure in your eye, potentially causing your retina to tear or detach. Additionally, diabetic retinopathy can also result in other eye conditions such as glaucoma or cataracts, which can ultimately lead to blindness. Diabetic retinopathy is a condition that can develop in people with diabetes, such as type 1, type 2, or gestational diabetes. The longer you have diabetes, the higher your chances of getting diabetic retinopathy. It's important to note that almost half of Americans diagnosed with diabetes have some stage of diabetic retinopathy, and many of them may not even be aware of it. There are certain factors that can increase your risk of developing diabetic retinopathy, including high blood pressure, high cholesterol, tobacco use, and being African American, Hispanic, or Native American. Diabetic retinopathy progresses through 4 stages. In the earliest stage, small blood vessels in the retina change and swell, causing microaneurysms and fluid leakage. As the disease worsens, blood vessels continue to swell and change shape, leading to a condition called diabetic macular edema, DME. In the 3rd stage, many blood vessels become blocked, prompting the retina to produce growth factors that stimulate the growth of new blood vessels. The most advanced stage involves the growth of new, fragile blood vessels inside the retina, which can lead to fluid leakage, bleeding, and the formation of scar tissue, potentially causing retinal detachment and permanent blindness. During your eye exam, your eye doctor will check for diabetic retinopathy by doing the following. Your doctor will dilate your pupils to look for any changes in your eye's blood vessels or see if any new ones have grown. They'll also see if your retina is swollen or detached. Your doctor may also perform a fluorescein angiogram, which involves injecting fluorescent dye into a vein in your arm. This dye will help your doctor see if any of your blood vessels are leaking or damaged, which can indicate DME or severe diabetic retinopathy. One common treatment for diabetic retinopathy is anti-VEGF injection therapy, which involves drugs that block a protein called vascular endothelial growth factor, VEGF, to reverse abnormal blood vessel growth in the eye and reduce fluid buildup in the retina. Some examples of anti-VEGF drugs include aflibercept, Eylea, bevacizumab, Avastin, and ranibizumab, Lucentis. Another treatment option is focal/grid macular laser surgery, where lasers are used to create small burns on leaky blood vessels in the macula. This treatment may be followed by anti-VEGF therapy. Doctors may also utilize corticosteroids, which can be implanted or injected into the eye to address diabetic retinopathy. It's important to note that corticosteroids can increase the risk of glaucoma or cataracts, so your eye doctor will closely monitor your eye pressure if you receive this treatment. Scatter laser surgery is another option, involving the use of lasers to create tiny burns to treat detached areas of the retina and shrink abnormal blood vessels. This treatment may require multiple sessions and can impact your peripheral, color, and nighttime vision. In some cases, a vitrectomy may be necessary to remove leaked blood from the retina and vitreous humor, improving cloudy vision. Your doctor will determine which of these treatments is appropriate for you and will perform them in a clinical setting. When someone has diabetic retinopathy, they may also develop a serious complication called diabetic macular edema, DME. The macula is an important part of the eye that allows for sharp central vision, which is essential for activities like driving and reading. If fluid builds up and causes swelling in the macula, it can lead to DME. DME is the most common cause of vision loss in people with diabetic retinopathy, affecting about half of those with the condition. It is more likely to occur in the later stages of diabetic retinopathy, but can also develop at any point. Unfortunately, vision loss from DME may not be reversible. It's important to work with your doctor to control your blood sugar and blood pressure, as this can help slow down or even stop the progression of diabetic retinopathy. Here are some additional tips to help prevent diabetic retinopathy. Make sure to schedule a comprehensive eye exam with an eye doctor at least once a year. If you have diabetes and are pregnant, be sure to have a thorough eye exam during your first trimester. Follow up with your eye doctor regularly during pregnancy, and let them know if you develop gestational diabetes. If you have diabetic retinopathy or diabetes, it's important to avoid smoking.